is the difference between a SOOF lift and a typical blepharoplasty?
Well, a SOOF is an acronym which we doctors love. It stands for suborbicularis oculi fat. And I've found back in the mid-1990s that I was unhappy with the lower lid blepharoplasty that I was taught during my training. I felt that it had too many risks associated with it. And the type of surgery I was taught was where you make an incision on the outside of the eye and you lift the skin and muscle here and you work on taking fat out here and then tightening the skin and muscle. And in some patients it works okay. A lot of patients I thought it looked artificial. And no matter who does it, you're going to get some patients that have what we call the round eye look, where their lower lid just looks rounded. It just doesn't look right. So I was trying to think of a better way to do it, and again, I got inspired by a doctor who was doing what's called a Madam Butterfly procedure and talking how it works to help ectropion. He was using it as a reconstructive procedure. And again, this is actually out in California, believe it or not. And I got the bright idea that maybe this is something I could use to rejuvenate the lower eyelid. And again, I went to the anatomy lab and worked out how I would do this. I found that it made a lot of sense structurally. And at that point, I was doing trauma work fairly routinely, which included the lower lids. And I found that patients who were older, who had broken bones here, when I went right down here to fix the bone, there was no fat. When patients that were younger, who had broken bones there was fat. So I made the assumption, and I think I proved that with my publications, that fat that's missing when we get older is the SOOF. The SOOF fat falls from here down to here as we age, which gives us this hollowness under our eye. And so I incorporated that into a technique that I learned to tighten the orbital septum rather than remove fat, a fat sparing technique. And I did that all through an incision inside the eyelid so you don't have an external incision. I've found that approach not only works better, looks better, lasts longer, but has far less risks than the traditional open approach that I was taught and that still most doctors use today. So I strongly encourage anybody who's considering lower eyelid surgery to find somebody that knows how to do the technique that I invented called the SOOF lift blepharoplasty. I think it's the best thing for them to do.